It's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients, and the question in last week's episode was, my sister is gone because the doctor had ultimately decided not to resuscitate my sister without my permission. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to start a new series of questions from one of my clients, Sharon, who has her 64-year-old mother transferred in the intensive care unit due to severe difficulty in breathing and alteration in mental state. Ultimately, her mother was diagnosed with liver failure and is on blood pressure medications and also went on dialysis due to kidney failure. So this week's series is, my mother is suffering from a severe liver illness and has been taken in the ICU for close monitoring and intensive medical care management. What can I do to help her? So, Sharon writes, Hi Patrick, my mum has liver disease, cirrhosis. She hid the diagnosis from us. A week and a half ago, she went to the doctor and he told her to go to the hospital because her kidney function was affected. She never told me or my dad. By Sunday, we called 911 and she was considered in shock because her blood pressure was so low. They got her stabilized and she started to recover. Then they moved her room and suddenly she couldn't breathe. It got worse every day, as did her mental state. So they decided to move her to ICU and give her a breathing tube, also known as an endotracheal tube, to figure out her lung problems and ventilate her. Initially, they thought it was ARDS, which is also known as lung failure, but it was actually fluid buildup. But after the breathing tube now, her blood pressure has dropped again and kidney function is worse. They inserted a catheter to drain fluids in the lungs and meds to get the blood pressure up again. Obviously, this is all caused by her liver disease, but it seems like every decision they make is wrong. Thank you so much for your help, from Sharon. So here's my response. Hi Sharon, thank you for sharing more about your mum's situation. Have they screened her for an infection? Also, have they started her on dialysis for the kidney failure? For example, low blood pressure can be caused by an infection but is often a side effect of the induced coma. Kind regards, from Patrick. Here is Sharon's response. Hi Patrick, where do they put the blood into? They also told us they think she is in the last days of her life, from Sharon. Here is my response. Hi Sharon, with the information that you have shared, I have not seen any evidence of your mother being at the last days of her life. Again, as we discussed on the phone, do not get bogged down by their negativity and keep questioning and challenging them. The next step for you is to ask for a meeting with the ICU doctors as soon as possible. Here is Sharon's response. Hi Patrick, they have been non-stop screening my mum for infections and everything keeps coming up negative. It is driving us nuts. No dialysis for the kidney failure. They said all they need to do right now is drain fluids, so no need for full dialysis yet. They didn't put her in an induced coma, they just sedated her. And they said they lessened the sedation. Her blood pressure was stable for many days and only went down when they put in the breathing tube. That said, she was also talking and eating, and then the day that stopped was when they put in the tube. Thank you, from Sharon. Here is my response. Hi Sharon, Thank you for clarifying your mum's situation. Induced coma and sedation tend to be interchangeable terms. And I have written an article about this, and you can check it out. You can click on the link to the article and video. What's the difference between an induced coma and sedation? For now, my advice is to be patient, Sharon. Things in intensive care are often a marathon and not a sprint. Also, it'll be very important for you to keep asking good questions, as this will help position your mum's diagnosis, her prognosis, as well as her care and her treatment. If you don't position and don't ask questions, the intensive care team will do it for you, and they do it with their own agenda in mind. Also, how old is your mother? And if you have watched this far and you want one-on-one consulting and advocacy for your loved one, you can go and click on the link below this video and book your free phone call with me. So I put a link below this video, and there's also a link on the top of the website where it says book free appointment or schedule appointment. So here is Sharon's response. Hi Patrick, my mum was just started on norepinephrine and epinephrine. How long does it take to get the blood pressure up? Thanks, from Sharon. Here is my response to Sharon's question. Hi Sharon, getting the blood pressure up in intensive care or getting the blood pressure up in intensive care needs to be looked at from various different angles. Blood pressure has most likely dropped for a number of reasons, and not only for one reason. The reasons contributing to low blood pressure or hypotension would have been: number one, the critical illness and the liver failing; number two, the induced coma and some of the sedatives or opiates, also known as painkillers; number three, the potential for an infection or sepsis, which I still believe can't be ruled out at this stage; number four, the mechanical ventilation; number five, low blood volume, also known as hypovolemia. I know your mum is in kidney failure, but she still might be slightly dehydrated depending on where the fluids are. They could be in the lungs or in the body cells as opposed to the blood vessels, which is where the blood should be. And number six, having a low blood pressure for critically ill patients in ICU can never be looked at in isolation and must always be looked at from different angles and the contributing factors. In order for your mum to get her blood pressure up, she needs to be on inotropes or vasopressors such as the norepinephrine or epinephrine, just like you mentioned. She also needs to have sufficient blood volume in the veins and arteries to maintain a sufficient blood pressure. Any sepsis or infection must be treated with antibiotics if they can find a source of infection, and also sedation and painkillers should be minimized as much as possible, because again, that lowers the blood pressure as well. I hope this isn't overwhelming for you, but again, many issues coming up in intensive care cannot be looked at in isolation because the body is a finely tuned machine. At this stage, from what you have described and shared, a low blood pressure is a concern, but the kidneys not working and the liver failing is a much bigger concern for now. In patients with healthy kidneys and no induced coma and mechanical ventilation, low blood pressure can be treated just with giving fluids. Giving fluids in your mum's situation might fix the blood pressure but could damage the lungs because the kidneys aren't working. Therefore, they most likely will weigh up what is most important at this point in time. For example, by putting your mum on hemofiltration, they will remove fluids and probably reduce her blood pressure even further. This can be managed with the norepinephrine and the epinephrine. Every action in ICU treatment can have drastic consequences for other body systems, and therefore the answer, I believe, the answer to your original question is really that it depends and what is the current priority. I believe the current priority are the kidneys and getting the hemofiltration going to reduce the fluids on the lungs. This will increase the chances to get your mother off the ventilator, reduce the need for sedation, and get the blood pressure back up again. I hope this isn't overwhelming for you, and hopefully it's not too medical. Again, intensive care treatment and critical illness is a marathon and not a sprint. Please let me know what other questions you have. Here is Sharon's response. Hi Patrick, what questions should I be asking on a daily basis? Hi Sharon, questions you should be focusing on a daily basis, and especially today, as well as for the near future, especially while your mother is ventilated and the induced coma are, you should be asking for daily blood results. For example, hemoglobin, which are also known as the red blood cells. Also, the white cell count, which are the infection marker in the blood. LFTs for liver results. Coagulation like INR, APTT. Coagulation is often going off the rails in liver failure, and therefore there is an increased risk of bleeding. I believe you mentioned when we spoke last night that your mother is already slightly bleeding from the skin. You should also be asking for results of chest x-rays in order to assess her breathing and lung function. You should be asking for ventilation settings and what is their plan to get your mother off the ventilator. Also, what's the plan to get her out of the induced coma and wake her up? Also, is she needing inotropes or vasopressors such as norepinephrine or epinephrine for low blood pressure, and how much is she needing? Also, what are their plans for treating the liver failure? Have they progressed with putting your mum on a liver transplant list? You also should be asking how much fluids they are taking off through the dialysis machine. Those are probably enough questions for now, and also keep asking them on a daily basis. Well, here's what Sharon writes back. Hi Patrick, I am doing a lot of reading, and it says the odds for people with cirrhosis that then causes multi-organ failure and low blood pressure and renal failure and over 60 in age is not good. I am losing hope. Here is my response. Hi Sharon, with the information that you have shared, I have not seen any evidence of this. Again, do not get bogged down by the intensive care team's negativity and keep questioning and challenging them, making sure that they are providing everything they need to provide for your mother. The next step for you is to ask for a meeting as soon as possible. Thank you very much for being a part of the previous series of this one-on-one consulting and advocacy sessions, and we hope you will find this new session from today informative and empowering. Keep looking out for the next session with Sharon in a few days. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. You can also call me. Find international phone numbers on the top of the website or on our contacts tab. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, and via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.